Hi, my name is Giovanna Jimenez, and I will be going over health disparities and inequities. So let's start with health disparities. What is a health disparity? Health disparities refer to differences in access to or availability of facilities and services. Health disparities are preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations. These populations can be defined by factors such as race or ethnicity, gender, education or income, disability, geographic location, or sexual orientation. Health disparities are inequitable and are directly related to the historical and current unequal distribution of social, political, economic, and environmental resources. According to the CDC, health disparities result from multiple factors which include poverty, environmental threats, inadequate access to health care, individual and behavioral factors, and educational inequalities. Moving on to health equity. Healthy People 2020 defines health equity as the attainment of the highest level of health for all people. Achieving health equity requires valuing everyone equally with focused and ongoing societal efforts to address avoidable inequalities, historical and contemporary injustices, and the elimination of health and healthcare disparities. Health equity is achieved when every person has the opportunity to attain their full health potential and no one is disadvantaged from achieving this potential because of social position or other socially determined circumstances. Health inequities are reflected in differences in length of life, quality of life, rates of disease, disability and death, severity of disease, and access to treatment. Okay, so now that we know what health disparities are and what health equity is, let's move on to some examples of health disparities and inequities in California and throughout the United States. The first health disparity I want to cover is the access to healthier food retailers. According to the Dietary Guidelines for Americans, persons in the United States aged 2 years or older should increase their intake of certain nutrient-rich foods, which include fruits and vegetables. Higher intake of fruits and vegetables might reduce the risk for many chronic diseases, including heart disease, stroke, diabetes, and even some types of cancer. In 2009, the U.S. Department of Agriculture estimated that 40% of all U.S. households do not have easy access to supermarkets and large grocery stores. Um, this health disparity is very relevant to my community in specific because there isn't, for example, a Trader Joe's or Whole Foods market around my house. But while I'm driving, I can count almost 4 McDonald's in a span of 2 miles. There are fast food restaurants on almost every corner of every main street intersection, and by having these fast food places so easily accessible to my community, it's not helping them to make better or healthier food choices. The next health disparity I want to talk about is unemployment. According to the CDC, the association between unemployment and poor physical and mental health is well established. Unemployed persons tend to have higher annual illness rates, lack health insurance and access to health care, and have an increased risk for death and not achieving optimal health equity. The unemployment prevalence in the United States increased from 4.7% in 2006 to 9.4% in 2010, which was roughly 14.5 million unemployed persons. The prevalence of unemployment and health status of populations vary widely among and within communities by age, sex, and race or ethnicity. The last health disparity I will be covering is binge drinking among people in the United States. According to the CDC, binge drinking is consuming 4 or more alcoholic drinks to 1 or more occasions for women and 5 or more drinks on 1 or more occasions for men. From 2001 to 2005, excessive alcohol use accounted for an estimated average of 80,000 deaths and 2.3 million years of potential life lost in the United States each year. Also, an estimated $223.5 billion in economic costs in 2006. Binge drinking is a risk factor for many adverse health and societal outcomes, which include unintentional injuries like motor vehicle crashes, violence, suicide, hypertension, sexually transmitted diseases, unintended pregnancy, fetal alcohol syndrome, and sudden infant death syndrome, just to name a few. These are just three examples of health disparities, and unfortunately, the list for health disparities in the United States goes on and on.